knowing your child and then also knowing my patients is really important because I'm seeing what works, but then we're still needing to figure out what that underlying issue is. He could be sitting next to a kid who has strep and he's a strep carrier. So that could essentially trigger something.
I gotta get myself a little more faith, a little more love.
I'm your host, Krista Bigler, and I'm going to guess we have at least one thing in common, that we're both in pursuit of a less stressed life. On this show, I'll be interviewing experts and sharing clinical pearls from my years of practice to support high-performing, health-savvy women in pursuit of abundance and a less stressed life. One of my beliefs is that we always have options for getting the results we want, so let's see what's out there together.
Just keep breaking. I gotta get myself a little more faith, a little more love.
Today on The Less Stressed Life, I have Erin Falco, who I saw present at a conference last month on nutrition things behind anorexia nervosa. But she also works with children and specifically with an emphasis in mental health. So she actually has this beautiful breadth of knowledge to share with us today. She did lots of things before she ended up where she is now, which is in private practice. She has a large private practice with an emphasis on nutrition for mental health, has worked with autism, ADHD, eating disorders, PANS and PANDAS. These are big time issues and conditions. So I'm just thankful that she is here. She's certified in functional medicine and ADHD and has completed a fellowship in integrative and nutritional psychiatry. She is a dietitian that previously worked in GI and eating and feeding disorders and mental health for 10 years before going off onto her own in private practice. So she comes with a lot of experience and we're excited to talk about cases and fun stuff with her today. Welcome, Erin.
Thank you so much. I'm excited to be here.
Yeah. You don't just jump into private practice and be like, I want to work with PANDAS. You just don't.
No.
There's actually a really small amount of people that I know that work with that. And so tell us how that happened for you.
Yeah. So I was practicing as a registered dietitian with a medical doctor when I came right out of school. And I was doing more gastrointestinal, feeding disorders, and just basic nutritional counseling with hyperlipidemia, diabetes, etc. And then when my son was 5 years old, he had an acute onset of severe anxiety, restrictive eating, and Tourette looking symptoms. It actually looked like he was having a seizure. So we went to about 12 doctors and couldn't figure out what was going on. And it led me to a functional medicine RN, actually. It was like 2 hours away. And we got this appointment. And through all of this specialized testing, she found out that he had an underlying autoimmune issue. And so we were digging deeper, and he had Lyme's disease and celiac disease. And then also on top of that, when I was looking at his medical records, because we obtained that from the pediatrician, it was the perfect storm of having vaccines when he was sick. So he had an MMR vaccine while he had flu and strep. And he was placed on 4 rounds of antibiotics in 2 months' time. And that was like the perfect storm. So all these underlying factors that we did not know about. And then on top of that, the strep, the flu, the vaccine.
That's so tricky when we have that. And that sometimes just happens. And it's not supposed to happen. We're not supposed to be doing that. But sometimes with public health, they're like, let's just do this at this time because they're there. And who knows what your story is, but it's a tough thing. And hindsight is always kind of 20/20. Do you think that I've seen celiac triggered by foodborne infections and pathogens. Do you think the celiac was triggered by an infection also? Do you have it in your family history or anything like that?
So interestingly enough, I was like, oh, that's weird. Who has celiac? So I never had gastrointestinal symptoms, all neurological. I would fall asleep right after I ate. I always had like low iron levels, but I also never went to the doctor because we never had health insurance. So I didn't have health insurance until I was adult, actually married. So prior to that, I always went to the doctor. I was actually a strep carrier. So you learn a lot about yourself because I had 42 strep infections as a senior in high school. And I didn't get my tonsils out until I was like 25. But I was a strep carrier. And then also I realized through my own testing at the same time, I said, who has celiac? That's interesting. He had the genes. We tested that as well. And then I wound up having the labs were positive for celiac for me. No GI symptoms. So I was like, okay, let me go get an endoscopy. So I got an endoscopy and my villi, the microvilli on the intestine that are supposed to stand up straight, they were completely flat.
Oh,
I was the one who had celiac and never knew. So
yeah, that's really tricky, isn't it?
yes.
So you found out about the same time you were unraveling all of his stuff. Right. So
Yep.
did you do the blood testing for celiac as the first line check?
I did. I will say that most people don't come up positive in blood. It takes a very long time for that to become positive in labs. So a lot of times there's false positives or false negatives. And so if there's symptoms, of course, a lot of doctors will say, oh, okay, let's test. But you don't have to have traditional symptoms. So iron, we look at iron in labs to see vitamin D markers, nutritional markers that are severely low. That can give us some insight to possible celiac. And then there's specific markers like endomysial IgA, which is like a good gold standard for celiac in the labs. A lot of times the kiddos, though, do not have positive markers. And then when they finally do get an endoscopy at some point down the road, then they are positive. So it's tricky.
Yeah, it is so tricky because you're validating that tests are always tricky and imperfect. And the gold standard is the endoscopy. And that's not what you're going to want to do on a child first.
No.
And there's so many things that could create low D and low iron also, like just many byproducts of inflammation. So that makes it super tricky. I wonder, so you work with ADHD quite often. And so this often comes up, gluten removal comes up a lot with ADHD. So I'm curious in practice with kids, how you are managing or assessing for gluten issues if the blood testing is not always, and even getting a blood pull on a kid is not very enjoyable, right?
Yeah, I feel like by the time the parents come to me after they've seen several providers, they're like, let's try anything. I usually will try one approach at a time if they're not wanting to do testing, because sometimes it could be where the lining of the intestine is compromised. And as a result, that food protein is a problem or inflammatory. So it could be either that, or they might be creating neuropeptides. So an example would be something called gluteomorphin. Morphine acts like a drug on the brain. So like an opioid-like response. Exactly. For me, I had this time. But if they're not willing to do testing, some parents are willing to take it out and see if that helps. And a lot of times it does. With other cues besides the blood, I'll look at skin. So you'll see the hyperkeratosis pilaris, which is like the chicken-looking skin on this, where eczema is a good sign. But if we're not doing testing for gluten, then I'll do a stool test or a urine test and see if there's any like bacteria or yeast, because that can block absorption of nutrients. And then also, of course, like our large food proteins. And gluten is just a large food protein, and so is casein. Those are like big components for inflammatory process for the GI tract. So as a result of the lining of the intestine being compromised, the food proteins are hard to break down. And as a result, they can become inflammatory. And we know that our gut and our brain is connected. So if something's going on in the gut, we know that there's going to be inflammation in the brain. So it really just depends on where the family's at.
Yeah. And then the end question, which is really months down the road after they remove it, is, do I need to remove this? And that's where they may at that point want to do some testing or not do some tests. People really land at different places. I totally get it. Okay, so with your son, with his PANDAS, let's talk about that process. And it was pretty rough. You saw 12 doctors before you went to the functional RN. And then alongside him, you had what I see all the time, which is everyone is like, oh, I want to check this on me as well. And so let's go back to his story a little bit and then tell us kind of some things that happened next. What were some things that you did that were really big game changers? And tell us about some of that process, the challenges, the successes. We learn a lot more through the challenges. So what was that like unraveling things for him?
We went through this whole phase where we were super scared. And as a parent, that's why I started working with pediatrics actually, is because of my son, and started delving myself in this area because I just don't want parents to feel what I felt. And we still feel like that because with PANDAS and PANS, there's always going to be an autoimmune challenge. So when there is a virus or infection that comes in with PANDAS or PANS, it affects the nervous system. So healthy neural tissue. So there can be flare-ups. And sometimes you're like, oh my gosh, I see that he's tics. I have severe anxiety. He's got OCD symptoms. He's, acting differently. And he doesn't want to go to school, he won't shower, whatever. And you're just like, okay, what do I do in this moment? And you don't always know because it's okay, now I got to rush and figure out what the cause is. Is it strep? Is it mold? Is it an environmental issue right now? Is it that he has RSV and I have no idea because his symptoms are different because he doesn't present normally? So it was really, I will say that it was a real challenge for the first year. Right away, he did beautifully. The nurse put him on an antibiotic, actually, which I really didn't want to do because he just had all these antibiotics. But she convinced me to do one round, and then she switched him to herbals. And we did like a combination of detoxifying agents and then anti-inflammatories, nutrition, and then herbals. And right away, like probably within 2 weeks of starting that treatment, different kid, relaxed, eating, sleeping, going to school. So it was night and day. But then in between, you have a lot of flare-ups, and that's what's really scary as a parent. It's just, what does he have now? What's going on? And without doing testing all the time, especially on a young child, you're not going to keep testing his blood all the time because that is traumatic itself. But then you just learn. I actually delved myself into the area so I could learn for my son. And that's why I'm such a good provider, I feel, because it's like I went back to school and I was like, I can't believe I don't know any of these things, especially the nutrition stuff. I'm like, I didn't learn any of this in school. I'm sure that you might have experienced.
Hear that from everyone. I hear that from pretty much every clinician, especially. They're like, I didn't learn any of this. I'm like, I know, no one did. And to your point, when you become a great clinician in an area when you've dealt with that symptom or that condition, because you understand it at this intimate level that no one else could, right? Even I don't care if you're seeing your GI doctor or whoever, like if they haven't had the issue, it's just different. It's just a more intimate, it's like having a baby and trying to talk to someone who's never had a baby. If you haven't experienced it, how could you, it's just different. That's all. It's just.
Absolutely. And you know what? There's other pieces to it that, you learn about yourself through it. And also just like genetically, like I have a very strong family history of addiction in my family and mental health challenges. And so when something gets triggered in your own child, you're just like, oh my gosh, the first thing I think is like my family.
Right.
I know that I need to work on preventing that at the same time. So through this journey, besides the infections and viruses and all of that, there are changes that happen. He's 10 now. There are other changes that you're like, okay, hormones are changing. This is changing. So there's been a lot of
what's normal and not normal. I was just navigating that with someone recently. I was working up around some diagnosed ADHD, and it was like the kids are having trouble focusing and doing this. And it's what is normal and not normal here, right?
And I feel bad. The other day, he was just like, every time I see something happen, and he's, Mom, stop staring at me because I got traumatized from that experience. And I think that's all parents out there. We're just always on edge. And all the messages that I get in between parents' appointments or patients' appointments is what do I do? And I feel for them. I really know because it's just, wow.
There's a whole nother level to. I actually make a joke frequently, 75% of my job is emotions and the other 25% is the other stuff. And it's probably more like a 50-50 split, but I was just having a voice dialogue, messaging conversation with a client. And I was like, okay, so we have to peel apart these two parts. First, your emotions of wanting to know everything right now, right? Because we're doing and then we have to be logical and scientific about how we're approaching these things. So we have done an episode on PANDAS with Dr. Emily, or I think she's a nurse practitioner, a PA. Maybe it's Dr. Emily Gutierrez out of Texas. And it was quite lovely. And you just ran through some of the hallmark symptoms of PANDAS diagnosis, but maybe you could tell us the difference between PANS and PANDAS quickly and how this starts to set off alarms for parents really quickly, just so we're all on the same playing field.
Yeah, so we now know that it doesn't have to happen just in pediatric. So I know that's the typical name, pediatric acute neuropsychiatric syndrome associated with streptococcal infections. So that's the PANDAS with strep. And then you have PANDS, which is pediatric acute neuropsychiatric disorder. So that can mean a lot of different things. Usually a child has an underlying autoimmune issue generally from the start, like underlying. And then what happens is there's a misdirected immune response when a virus or infection or pathogen comes in, whether it's environmental, whether it's an infection or a virus. PANS can be a lot of different things like mycoplasma, mold, Lyme, different co-infections, food allergies, all the things. So just really just depends on what that trigger is.
Yeah.
And then, of course, you've got genes and then the perfect storm for some sort of acute trigger and even trauma. There's just so many different things, and that's what makes it really complicated. And I also think that's why it's really hard to find specific people who work in this area. More like mainstream medical doctors are just a lot of the doctors that I'll try, because I don't prescribe meds. I'm not a doctor. I use herbals and supplements and homeopathic remedies and food as medicine. But it can be challenging to work with some providers because sometimes they really need their support. So in my area, New Jersey, there aren't like a lot of providers. And the ones that do work in this area, you can't see them for a year, the wait list. But a lot of my patients' the parents want to be in person. And sometimes the referrals that I have, I built a really great referral network to doctors that from going to all these wonderful conferences, especially like Dr. O'Hara, Dr. Song. I love referring to them, but I've also seen them at a million conferences. I've learned a lot of information from them. Dr. Debbie Hamilton, I work really closely with. So there's a lot of physicians I really trust and I can work with, but it can be really challenging to work in this area, especially it's
a lot of emotions. It's just a lot. And when I heard you presenting and talking about some of the things that you were dealing with, and actually I'll probably prompt you. I just remembered such a good case study you shared at the conference I saw you at. And so I'll prompt you about that in a bit.
Oh, sure.
But first, I'll summarize that when we're talking about a diagnosis, I will say like the emotional roller coaster is people want the diagnosis because they want the answer. And then they realize the diagnosis is very much a tip of the iceberg. And you would probably agree, I don't know, but like a diagnosis isn't always necessary, right? You can have a set of symptoms and then you still have to go through layers of, we're just onions. And so even with your own son's case, there was layers of onion stuff. Although when you're doing the right things, the turnaround, like there was positive feedback. Mm-hmm. The other beautiful thing that I have to highlight is that there was also failures. You called them flares, right? And that's just part of the story too. And if you don't acknowledge the good stuff in between that little bit of a roller coaster, it could feel really disappointing, which just fuels that emotional negativity bias. So I just offer that because I think the thing that makes the area that you're working in so challenging is that there's emotions on steroids here. Like it's like really intense.
There's a loss of hope sometimes because you're just like, I can give my son really high doses of fish oil to decrease the inflammation right now for this flare. And I don't necessarily know the trigger. So I'm also guessing sometimes, right? Unless I'm testing, and that test could take some time to come back. So knowing your child and then also knowing my patients is really important because I'm seeing what works, but then we're still needing to figure out what that underlying issue is. He could be sitting next to a kid who has strep and he's a strep carrier. So that could essentially trigger something, but I wouldn't know that he's actually suffering from strep because I wouldn't know unless he has that some symptom.
Let's dispel the statement you've used a couple of times, which is being a strep carrier. If someone, hey, she says that she had strep 42 times, instantly someone came to my mind. What would you say to the person that's like, how do I know if I'm a strep carrier?
Yeah. So we naturally all have good and bad bacteria. It's necessary to have a nice balance, healthy, like a biotic relationship in our intestine, right? We're supposed to have yeast. We're supposed to have certain types of bacteria, even strep. We're supposed to have a little bit of that. But when it gets overgrown or it's more opportunistic and I just naturally carry more of that types of bacteria, I just carry more of that, then you could be considered a strep carrier. Just naturally produce more of that type of bacteria. And there's so many different strep strains. Keeping that strep down and keeping the good guys up, it's not as easy as we think it is.
I'm sure that it's an ongoing balance that you have to play with a little bit with. So that makes sense. Let me jump to, before I forget, this story that you told, if you can remember, at the conference that you spoke at last month. I think you were mentioning, let me see what I remember. You were talking about a case, and I think the woman had extreme something. I don't know if she had anorexia. There was extreme mental health stuff where she came to see you one time, and I think you pulled some labs. I don't know if you pulled labs or not. She saw you one time and then disappeared, but then she ended up inpatient in the hospital, and the provider called you because you were the only person in like a recent span that she had seen as a practitioner. And there was it was a very interesting summary of give her this, test her for this, and give her this. And then she was like quite a bit better. And it's such a fascinating story. Will you tell that story a bit?
Thank you so much for remembering, by the way. I appreciate that. Yes. I've never had a case like this, actually. So that's why I have tons of cases, but this case really stood out.
I love cases.
But that's...
I love case stories, case studies.
Oh, okay. I would love to just like present cases all day long. Yeah. So I had this patient who she has had the diagnosis of anorexia, and I ran her vitamin panel. I ran B12, I ran some folate, I ran a marker called homocysteine, which kind of tells us if there is a deficiency in B12. It's like one of the gold standards for seeing if there's a B12 deficiency. So I ran that, and it was the highest possible level that I could see. And I recommended her to do B12 shots. And at the time, literally, I only saw her once, and she was like, she was petrified of shots. She had severe debilitating anxiety also, which is common in B12 deficiency. A few weeks later, go by, and then the doctor calls from this inpatient, and he says, see this patient, she's got severe psychosis, and she said that the only person that she saw, and I was the first dietitian that she saw for her eating disorder. She didn't even see a therapist. She said that you said there was this marker in her labs. I'd like to see her labs. So I talked to her about it. He said, I have no idea what you're talking about. So I said, if you just give her the B12 at this dose, and I gave him the dose that I would recommend. And then he called me back and he said, within 3 days, she was completely fine. Like, that's all they did. She refused medication, and they just gave her the B12, and she was fine.
It's such a dramatic story, right? And because if she had accepted the medication, stereotypically they would be like, that's the answer, right? Of course, right? So it's such a dramatic case study story, because it's so rare that like a nutritional nutrient would be the only intervention for such a crazy situation, right? For such an extreme scenario. And so I just like wonder what happened to that doctor, right? If he was like, my life feels different now.
I know. I don't know about you, but I like take every opportunity I can to educate someone who doesn't know, because it helps everyone. And I'm like, I was always that dietitian in the hospital too. When we worked in the hospital for clinical rotations, I'd chase the doctors down. This is what I recommend, or because I was like, we have such a large impact. And now that we know more, we have the opportunity to educate as many people as we can so that everyone can be helped.
Yeah. Look at your nutritional biochemistry and then have a conversation with the doctor about it. And they'll be like, oh, I don't know why they're giving them 50,000 IUs of vitamin D2 when your kidneys don't even, when the kidneys don't work and it gets converted to D3 at the end. Like, they're just doing that because they don't know. Anyway, so it's a great experience to delve into nutritional biochemistry in your area that you're actually recommending those nutrients. And I'd like to point out also, because people wonder about nutrients, or they may believe that there's a lot of options for micronutrient testing. There are some. There are not a huge, unfortunately, we don't universally agree about pretty much most tests that you've mentioned. And so I'd like to share that, because if you go in, and so this is a bit tricky. And so I just want to offer that people may say, I went in and I had labs and everything was fine. Okay. They checked like a couple of things. And so anything that you just mentioned, but especially those nutrients, you can ask for those nutrients in the blood. The accuracy of nutrients in blood can vary. So I'll just mention that as a big umbrella statement.
Oh, yeah.
But those are available. Those are possible to be drawn. And then you have to know to ask for those. But there's a lot of nutrients that you really can't draw. There's a couple functional labs that offer large micronutrient panels, but just universally, we don't actually agree about most nutrients pretty much at all. So I'll just offer that. And if you have any comments there, fantastic as well. But so what's cool is you were able to do blood for those particular tests. So you got to take what you can get sometimes. And sometimes the getting is great and sometimes it's not.
Absolutely. And I think it's nice because patients are already willing to pay out of pocket for lab if they're not able to get it from their doctor because they're just not feeling well. So this person in particular, I just wrote the labs and I only saw them once. I actually wrote the labs and I was lucky enough to be able to see them and then didn't want to do anything to them. And
most likely, I'll just offer, like, my experience is that it's not expensive to do those particularly very cheap.
No.
Actually, compared to even if you would go in, part of the reason that maybe the provider doesn't draw those, besides not knowing or understanding them, is maybe it wouldn't be covered by insurance. And when you run anything through insurance, the cost is like super duper inflated to this crazy amount. So you might as well just go order them on your own.
Yes.
My experience anyway.
No, you're right. And that's why I've had patients who I'm saying, let's go get these covered. Let's see what happens if your doctor writes these. And then they'll say, oh yeah, my doctor said that they're not going to get covered. I'm like, okay, here's this. All of these labs will cost $200 if you get them done. And then they're like, oh, my doctor said that they might not get covered, but I'm going to go through my insurance. So I just want to risk that. It's okay. But then they get these bills and they're like thousands of dollars. And I'm like, oh no, I wish that I know.
But this is a good story right here. It's good to mention, like, you can order labs inexpensively on your own if you're ordering. There's multiple places online you can order from, and it's probably cheaper than even trying to run them through your insurance. So it's a crazy world. Here's your tip of the day, which we're thrilled to be able to share. So this is good. Okay. And one more thing about your son. How old was he when your journey started with PANS and PANDAS?
5.
So now he's 10. So you've been going through that for about 5 years. So amazing. Okay. Once you started to understand PANS and PANDAS, the box was just wide open. Like, you could do anything after that. And tell me a little bit about, there's some other conditions that you work with a lot. Now, you worked with eating disorders before. We just mentioned briefly an eating disorder story. And maybe we'll come back to that around nutrient deficiencies. Or maybe I'll go there first. Nutrient deficiencies in eating disorders. There's several things that you look for both. So this is a cool topic that never gets talked about on this podcast. We just talked about some blood labs that you did, but there's also, like, you can look at a person and see that there are some nutrient deficiencies. And we never talk about that here. So would you want to talk about nutrient deficiencies in respect to disordered eating and anything, like maybe 4 points of interest or whatever you feel like that people can do looking at themselves for a nutrient, like a nutrition focused physical exam a little bit? Do you want to talk about that a little bit?
Yeah, absolutely. I love a nutrition focused physical exam. I spend a good time speaking to other RDs about this and teaching about this. So I like to look at the tongue. That tells us a lot of things, especially about the gut. So typically, if there's a thicker tongue, that can be related to niacin deficiency. Or if there's a white-coated tongue, that can be related to dysbiosis in the GI tract. And when there's dysbiosis, especially yeast, that blocks absorption of other key nutrients that are important to regulate our nervous system. So meaning helping us to relax, have happy thoughts, to sleep, have normal appetite. One of the key factors I always see in anorexia, but other populations as well, is zinc deficiency. It's one of the most common nutrient deficiencies, and it's not stored in your blood. It's very difficult to test for. It's stored in our cells and our tissue membranes. So it's really impossible to get an accurate reading in labs, but you can look at fingernails. The white dots on the fingernails, one of the key components of zinc deficiency. You can also do a test strip or a aqueous zinc solution. So the aqueous zinc solution is fun because you just put it in your mouth, you swish it around for 30 seconds, and if you taste nothing, then that means there's zinc deficiency. And why that's important is because zinc is crucial to help us with our stomach acid to break down key enzymes through our food. So protein digestion, very difficult. Carbohydrate, even fat digestion, all really difficult without adequate amounts of zinc. Because zinc helps our digestive enzymes. And digestive enzymes are what help us to break down and use our food for fuel. It's not just about what we're eating. It's about how we're using the food.
Nothing works when your digestion works. And pretty much, I just don't see people having good stomach acid, period. Stress will deplete stomach acid like right away. There's multiple nutrients that are implicated. And that was a takeaway. And so when you were speaking, you had another doctor that was speaking, and his entire thing and his whole book is about zinc and maybe anorexia relationship. And he has a very disruptive kind of statement. Is it the chicken or the egg? Which one comes
Yes.
first? Is the zinc deficiency potentially even causing anorexia because the symptoms are so similar? It almost reminds me, I wonder if I can jog this from my memory. It almost reminds me of COVID symptoms. It was like the same thing. I think it was also zinc deficiency, maybe. Was it zinc deficiency? And then they would talk about COVID symptoms. I think that's the same thing. Yeah, I think it was all the same stuff. And it was like, here's all these post-COVID symptoms. And they oddly are also zinc deficiency symptoms. But to your point, like testing is a little bit tricky. And that was a takeaway I took from that presentation. Yeah, this is a problem, but we haven't really been able to test it. Erin, do you use HTMA testing in your practice?
I do use that. I do use that pretty often.
So a while back, my college-age daughter shared with me that she was tossing and turning and waking up several times per night after a period of stress. We started her on magnesium and her sleep immediately improved. I personally think magnesium should be your first thing to try if you're having trouble sleeping or staying asleep, especially tossing and turning, and it's a no-brainer if you have any restless leg issues. The thing about magnesium is that there's a lot of types of magnesium that will give you symptomatic relief, but I like to steer my clients and loved ones to a more absorbable form of magnesium because most big box magnesium is mag citrate, and that will push bowels that can be damaging to your teeth if it's used daily, and it's not the most absorbable. Rather, Jigsaw Health makes one of my favorite great tasting magnesium powders called Mag Soothe that has magnesium glycinate, my favorite calming and absorbable type of magnesium. It's available in both a great tasting powder and to-go packet. And they also make a product that's great for slow release, especially if you have restless legs, called Mag SRT. So if you are not falling asleep easily, or if you have disrupted sleep, you can try at least 200 milligrams of great magnesium like Mag Soothe or Mag SRT, especially if you have restless legs. It works better to take this at least 20 minutes before you go to bed to allow it to kick in. And you can get a discount on all of Jigsaw's amazing products, including Mag Soothe, at Jigsaw Health with the code LessStress10. Now, you can use LessStress10 as many times as you want with every order at Jigsaw Health, which is honestly pretty unheard of with coupon codes. So enjoy the magnesium from Jigsaw with my code LessStress10.
I find it really great for certain nutrients and really good results. But then I thought about the symptom profile. So I started looking up clients that I was like, I feel like they fit this. Let me go look at their zincs. And they looked so good. And I was like, I think I'm going to have to be I think the only option is to do zinc assay testing, which is what you just described.
Yeah, safe to say, if you're working with an eating disorder population, they're all zinc deficient. So you can add zinc in, no problem. If someone has digestive issues, add zinc in. If someone doesn't have the appetite for meat or they have sensory disturbances around food, you can safely add zinc in. So it's just something you have to be careful because it's a metal and the dosaging has to be right. And you do it for a certain time.
And it will often make your stomach hurt if you're not eating with it typically as well.
Yes, you usually have to have it after you have your meal.
Yeah. And this is my thought, but you can jump in wherever you want here. It has a balance with copper. And I just want to caveat here, like it would be a test and then I wouldn't just stay on that forever either.
Yeah, because copper and zinc seesaw.
Exactly. It's like usually how I was trained in it originally. Although even stuff I learned when I was doing different comprehensive micronutrient testing, you start to just challenge over time and there's different philosophies. But what I learned was I think a 15-to-1 ratio of zinc to copper. To address that would be you can do a balance of the two of them, one capsule as well. So.
Yeah. And even if you just have a little bit of the copper in the multi, if you're doing a multi, that sometimes I feel like can be helpful.
Yeah. Usually it's 1 or 2 milligrams or 3 milligrams approximately that you're looking for, which just to give people a starting point, it's not something crazy. Okay. Did we get through the nutrient deficiencies you wanted to briefly mention around anorexia before I go to some other conditions that you work on?
Yeah. So we talked about zinc, which is a key one. The other one, I would say essential fatty acid deficiency. So omega-3s. Most people have a deficiency in omega-3s anyway, but most of the time in anorexia, there's an omega-3 deficiency as well. So dry skin, like eczema, dry hair. Those are some signs as well. And sometimes besides that, low cholesterol as well. Not low cholesterol, high cholesterol. I'm sorry. Low cholesterol is more ADHD, actually. ADHD and autism is low cholesterol. Most patients with anorexia will have higher cholesterol levels, but that's just the way that the body is storing fat. which is really important. Cholesterol is very important for our brain. We want as much cholesterol around our brain as possible because it's important for our hormones and also for our neurotransmission and our neuroplasticity.
Yeah. Very essential. Yeah. I was going to say dry skin, dry hair also.
Yeah.
So very easy ones. It gets used up a lot in the inflammatory process also.
Yeah.
I think it's just one of those things that there's some nutrients that you test or like when people do self-tests for stomach acid, like it's never good. It's never good.
No.
So just skip testing at this point. No one is ever adequate. When you have the signs and symptoms, I think that trumps it. And that's going to be a question I want to get to later is testing is a great. And then sometimes you're like, I don't really need this test. Like I could just look at you and be as well. So you just brought up low cholesterol being a biomarker that shows up in autism and ADHD, which are the other conditions that you deal with, work with in your practice. What do you want to share about this? Or maybe you want to think of a case, since you love cases as well. Maybe you want to think of an ADHD case recently. That was
Yes. Okay. So this kiddo has presented more with OCD symptoms, but and I like to put, I don't like diagnoses, by the way. I always like to put air quotes on them because it just describes how our brain is working, right? We all have different brain neurochemistry and it just mixes sometimes. That's how I like to think about it. But this child came in with acute onset OCD as well, but it wasn't actually, in fact, there was actually more nutritional. So we did labs, no infections or viruses, even though I know that can be clinical, but there wasn't anything recent either. But in his labs, his cholesterol was like 100 and we wanted over 165. So there can be a difficulty with cholesterol metabolism. Actually, I think I might have shared this case in the presentation that I gave. But anyway, that's okay. So this kid, he had 100 cholesterol, and then also there was Clostridia, which I didn't find out until a little later. And bacteria can impact cholesterol metabolism.
Yes.
So especially Clostridia, actually. But no, he had really low cholesterol, and I actually gave him a mitochondrial multivitamin first, and then to get some nutrients on board. And then I gave him really high doses of omega-3s. And then while the testing was coming back, and he also had, sorry, to go back, he had really low iron as well, which can also happen with low cholesterol. Nutritionally, and there was most likely some sort of genetic SNP in cholesterol metabolism as well. And then on top of that, he had some Clostridia. So we treated all those things, but literally within 3 weeks, new kid, no OCD symptoms. Like he would line up all the colors and wasn't able to like transition at all and wouldn't had the lights like up and down a certain amount of times, 10 times. The spinning of the fan, he'd had to count 25 times before he can go to the next step. None of all of that was
I love that you said 3 weeks because I always think like 3 weeks is if you're doing an intervention, usually you'll see something typically within a few. This is my belief. I've seen many times. What I remember from your presentation was that you talked about Clostridia being implicated with OCD.
Yes, definitely impacts dopamine metabolism. So dopamine is that excitatory neurotransmitter that a lot of times contributes to that diagnosis. And that's where we get the tendencies.
I would imagine that the Clostridia also can pop back with some ease. We talked about this with strep, but just knowing how things go with people. Every time I've seen OCD, again, that diagnosis walk through the door, I always feel like there's some other gut imbalance at play, and typically it improves. But then sometimes what I will offer to people is that, and especially this is part of the emotional roller coaster, is you want to resolve things and never deal with them again. And your story very clearly illustrated, like that's actually not the situation. You're becoming fluent in a set of things and then you're learning how to deal with them, you're learning how to manage them so your life doesn't feel out of control. That's largely what you're doing. You're not trying to stick your head in the sand and outsource it to Erin or whoever. It's like you're becoming a person who can write the manual about it. It's like a little bit of a shift that we have to have sometimes because you don't just shut the book and say, I don't have that issue anymore. It's like, I might have, if I'm seeing some OCD symptoms and they were previously resolved, what might that tell me? Oh, that might tell me maybe that I have some imbalance that I might need to clean up a little bit, right? And so there might be testing involved at first, and then you might learn to trust your own intuition about that and realize maybe I don't need the test to prove that I have that. Why don't I do the intervention and see if that resolves things?
Exactly. Especially since you start to realize even your own history and then the trends, which is why we always do that full history from birth, right? What's happened
there's
like 10 years ago, but then you know.
Really to be able, I need to come up with a really good prompting template for that. Some people come in and have this beautiful like timeline, and some people don't do it as well. And if you understand your own timeline, it's, you don't like, it unlocks so much for you. It's here's your test right here. Just tell me your history.
Yep. Exactly.
There's a lot there. That's beautiful. Okay. ADHD, OCD, Clostridia, cholesterol. Anything else about that particular case? Are we good there? I was maybe going to say that you probably looked at urine testing, organic acids, to find that the Clostridia was elevated.
Yes, and the stool together. I always like to do the urine and the stool just in case you get in the urine. I want to see if it's colonized in the GI tract, and then also, what kind of strains and what the good guys are doing, and if there's inflammation and all the things, digestion, absorption.
And I will offer that I'm sure Erin would agree with, is that every clinician will interpret testing a little bit differently. And sometimes the test, I do think that kids have more honest tests generally. This is my impression with testing children and adults. Like sometimes you just do not see all the things, but it's just a quick snapshot in time. So I'll just mention that. But I see a lot more like crazy stuff in kid GI tests than I do in adult GI tests.
Yeah, I do too. I'm glad that you brought that up. It just really,
I just tell people like kids are more honest. And I think that adults have more history and layers of things. The more inflamed the GI is in an adult, sometimes the more unremarkable their stool test is. And then I have to throw it out and just move on with my life and correct the symptoms.
Challenging.
Because
you just made a good point. Sometimes when you're doing the stool test, let's say they have SIBO. We might not be getting all the stool from the small intestine.
Right.
Just doing it, they might be constipated. You're like, that part of the stool. So how do I know what's going on there? It can be really tricky.
Yeah. And biofilm formation over time. So things like you have to allow the symptoms to play a greater role than the tests. And I hope that becomes more, like that's going to be my mission moving forward, is like empowering people to understand that, because that's the thing is we tend, in general, what I notice is that we are trying to outsource things, and that's understandable because we're like, I don't get this, so I need help. That's reasonable. Sure. Our end goal is that we do want to understand things. These are skills we get to build, so that way we can help ourselves in the future. A lot of people, I see this sometimes. Sometimes people come in, or I've seen this, clinicians do this, and I'm super neutral. I just don't think it's a end all be all. So I'm just going to talk to you about it for a second. So there's a urine test that you just, that showed one way of Clostridia, shows some nutrient markers, shows some digestive markers, organic acids test. It's easy for kids to do. It's very popular for kids to do. There are some fungal markers on that. And sometimes people use that as, hey, maybe there's a fungal situation here. I don't always pull mycotoxin testing because sometimes I'm just like, this is clearly mycotoxins from symptoms. But sometimes I do if we need to get on the same page or just need to rule some things out. And I do find I like the urine mycotoxin testing after testing multiple tests and people. And if you have any thoughts on that, cool. You've only really mentioned, I feel like you only mentioned mycotoxins one time, and I talk about them quite a bit. So I'm curious if you do much testing for mycotoxins or if you rely on organic acids.
I do sometimes do mycotoxins if I feel like the patient's symptoms are there, as well as doing an OAT panel, because I like to see what their body's doing also. I'm not someone who likes to guess right off the, if we can test, let's test. Unless I have a lot of history, if someone's coming in from another physician or provider that already has like tons of testing, I'll just go by that. But I wouldn't say it's like my first go-to, especially with the kiddos. There are a lot of other layers. I see both adults and kids, but I find that I'm seeing more kids recently. So it's not like my first to go, but if the family they're all having like weird symptoms and sensations, I'll definitely test the kid for mycotoxins as well. But I usually pair that with other tests at the same time, not a standalone.
I agree with you. That's a good point. It's almost a second level thing. There's just some things, and I wonder, I'm sure you see this too. It's like the comment about zinc and omegas. It's like you start to see things and you're like, I cannot unsee this thing that is there often. You mentioned your son having Lyme earlier. And that's also tricky testing wise also, because that is not necessarily going to show up as positive. Are you doing Lyme testing or not really?
Yeah, I am for patients. I can't say that I won't treat them. I treat their gut, I treat their immune system, I treat the digestion absorption. So I support that part of it. I don't like use herbals or use medications, obviously, to treat Lyme myself, but I will support them from a nutritional standpoint and from a detox and from a GI standpoint. I just don't think that's an area I think I will ever go into. I just find it really complicated and very difficult, but I will also use hyperbaric. I have a hyperbaric oxygen therapy in my office, and it was a game changer for me and my son. So we use that and red light in conjunction, and I might be dabbling in a little bit of methylene blue. My son, going back, he actually had CDC positive and alternative positive. So not only just once, but twice. So he actually is a rare case, not rare, but it was actually CDC positive, the standard testing. And that, of course, he had the alternative as well. But a lot of my patients, I'll do the alternative testing. And I'm like, oh, wow, co-infection virus. Like I'll use a specific, I don't know if we're allowed to use specific panels or anything on the podcast that we use, but okay. Yeah. Sometimes I'll just use the Vibrant, and I find that helpful. And then I'll just refer to a doctor that I feel comfortable with, but I'll do all the other things with them.
Yeah. I will not treat. I don't have people really walking in the door for that either, but I've talked to a lot of people who've dealt with it, and people have different opinions and things, but we align pretty well there. So just curious what you're doing. Let's take a quick detour to talk about HBOT being really helpful for you and your son before we tie this with a bow with autism conversation.
Sure.
Funny enough, the other person I interviewed on PANDAS is obsessed with HBOT, and I was about to get one at that time, and then it just keeps resurfacing the last couple of months. I was like, yes, I should get an HBOT. So tell us how it was amazing for you. Tell me about how it's amazing for you, your son, and how it's going implementing into practice.
Yeah, HBOT is really good for energy, basically, but it helps your mitochondria, the energy of your cells. And so for me, I had a few concussions, actually. One was surfing and one was on the bumper cars at Great Adventure. And the first concussion, I woke up one day. I wasn't sure if I had a concussion from the bumper cars or not, but the next day I stood up and I literally fell over. I got up and I was like, oh my gosh. And I was really sick. The rooms were spinning. My blood sugars were like 40. I had to put a monitor on it. Yeah, I literally went to all the different doctors. I was like, what do I do? But I eventually went to this conference, like post-concussion. And while I was there, I won a certain amount of money towards the hyperbaric chamber. And I was like, okay, cool. I have to get this. My son has Lyme. And then I found out that I had Lyme, actually, through all the things. And I'm like, oh my God. So I went into the hyperbaric chamber, and it was right before I went to Portugal, actually. And I was so worried about not being able to feel good because my legs were I think this was like a trigger. The concussion was a trigger, and then it just brought out all these things. I was so sick. I was so tired. My legs were just killing me. I hardly could walk. It was terrible. And so I was lucky enough to be gifted with some of the money for the hyperbaric chamber, and I bought one. And I was like, if anything, I'm going to use this, and then I'm going to donate treatments. I'm so grateful. So I did. I started donating treatments to pediatric cancer patients. And then patients who couldn't afford it, I would donate some treatments to them as well. But
I love that.
Let me just use this as my giving back. So I did 40 treatments right in a row, right before I went to Portugal. And I just felt better and better after every treatment. And I think, because I really didn't do much other than that, and a little bit of herbals and stuff like that. I think that's really what helped me recover.
Yeah.
So it changed my life. But now I use it when I'm having a brain fog or something. I'll just jump in and I'm like, okay, I'm good.
Yeah. We're doing a specific HBOT episode in the next month. But how about your son? When you had him do HBOT, what did you see?
For sports, he would always complain, oh, I'm really tired. I feel like you would see it on the field. So he'll go in if he has an injury, but also I used to use it for him more often. I wish I had one at home. I don't, but just to get in more frequently. But yeah, you can notice a difference between just the energy, and then also just it helps him to relax a little bit more. I noticed right after, I feel like he's always in like a Herxheimer reaction, but right after he's like more relaxed too.
Yeah, super cool. Okay,
Yeah.
another condition that you treat is autism, and we're having fun with case studies. So if you want to offer any case study around autism,
I have a really good case study.
Perfect.
Very good case study. Okay. So I actually presented this at the New Jersey Dietetic Conference with Dr. Richard Bowles, who is the owner of, I can use the names, right, of the companies. Okay. He is the owner of NeuroNeeds. I'm not sure if you're familiar with that company. Okay. So he's pretty much one of the only ones in the country who does the full genome sequencing. So he has like 100 published papers on the mitochondria, on mitochondrial disorders, but autism is a mitochondrial disorder. So one day I went to this conference and I saw him speak, and I actually didn't understand, being honest, I really didn't understand everything that he was saying. But my takeaway was, okay, nutrition, mitochondrial disorders are nutrition related. So these keys that we need for nutrients to be used for our brain and for our body are the keys that are important to use for spectrum disorders. Okay. For speech, language, etc. So there's this supplement that's mitochondrial cocktail. And I'm like, let me try this with my son. My son used to have a hard time reading in school. So I gave it to him, and I always try everything on him first. He's my guinea pig. But I tried it on him, and I actually took it myself. And I started noticing that he was doing better in school. And I'm like, that's interesting. I took it away. And then I noticed that he wasn't doing as well. And not just that, but like little things. I'm like, wow, he's talking more. He's more elaborate. He's more specific about his conversations. He's got a little bit better auditory processing. And even with myself, I'm like, wow, I had this child, he was he was 22 at the time, who came in non-speaking. And he was actually coming in for constipation and severe anxiety. So his mom referred by a psychiatrist. And so he was on a medication, and the parents are either not working anymore, plus he's really constipated, non-speaking. So I said, all right, he's never been on a gluten and dairy-free diet before. I'm going to put him on that. And then let me use this supplement, this mitochondrial supplement. So I gave it to him, and a month goes by, and then he comes in and he's sitting in the waiting room and he says, hi, Miss Erin.
Oh.
Never spoken a day in his life.
Oh my goodness.
I know.
Were those the first words?
Yes. So I said, I don't know what happened here. I have no idea what happened. So I call.
Was the guardian with him?
Yeah. Oh yeah. They were like crying because they were like, he's doing so well. We're starting to speak. We don't know what's happening. I didn't know that was wasn't expecting that. I thought I was decreasing inflammation. I was like getting his bowels moving. I'm like, let's work on anxiety. So I said, oh my gosh, I need to figure out what's going on here. So I called the company, and I called one of the owners, Chris, he's one of the owners. And I said, am I able to talk to Dr. Bowles by any chance? I know that this is like a long shot. I don't know him, but I saw him speak at a conference, and I really need to talk to him. I get him on the phone, super nice. And I was like, okay, I gave him this supplement. I don't really know what happened. I'm not sure if it's a combination of all the things, but what happened? He goes, Erin, he has a treatable gene. I said, what do you mean? So I was like, okay, what do I do next? And he's like, okay, you're going to test for this SNP. You're going to test this. You're going to test that. And I'm like, okay. So I did it, and we found out like some of the SNPs that he just needed more support with. So I started using those interventions, and he's doing great. He's social. He was making eye contact. He wasn't making eye contact the first time either. Making eye contact, tactile is great. He's writing. He's going to school. He's riding his bike. He's hanging out with his neighbors.
Oh my gosh, he has a whole new life at age 20.
Whole new life.
Yeah,
I've been seeing him for a while now, still seeing him. But yeah, they let me speak at the I actually reached out to him because the New Jersey dietitians asked me to speak on something for pediatrics. And I said, I would love to, but I really want to speak with this doctor. So I only talked to him that one time. And then I was like, hey, by any chance, would you come to New Jersey? I know you live in California. Will you speak with me? He's absolutely. He flew to speak with me. And he talked about the science because it's all nutrition related. The mitochondria is nutrition. Right. So what a big impact we can make as dietitians if we just know a little bit more about how nutrients affect the brain. And so while I didn't know much then, now I know, I delved myself into it because I'm like, I can't not know. I can When you
game over, right? It's like you cannot unknow the end.
No. So I had to share that story. Thank you for letting me tell you that.
I love it. I think we could do part 2 on all case studies, the end. But that was such a blast. And we covered
Thank you.
tons. We talked about how this all started because of a painful experience that you had was the catalyst for all of this and the catalyst for all your patients' lives. So let's just let that sink in for a second. That very often our pains are the like actual catalyst for maybe our mission or purpose in the world, right? So not to be gone over too quickly. We talked a bit about nutrition-focused physical findings and common nutrient deficiencies and anorexia while also touching on nutrient testing. We talked a little bit about being a strep carrier. We talked about infections, secondary infections. We talked about mitochondria. We talked a little bit about Lyme and mycotoxin testing. We also talked about autism and ADHD and OCD and cases related to that. So that's quite a really, who knew we could get through so much in an hour, and what a blessing. Erin, where can people find you online?
Roothealth.com.
And
our Instagram handles.
RootHealthNJ.com. RootHealthNJ. For some reason, I think I cut out right then.
Oh, no, it's okay. Sorry.
Yeah, perfect. Is there anything else that you would want to tell people if they're listening to this, maybe especially a parent going through emotional challenges, trials? Is there any message you would want to give them as a provider or as a parent to them to wrap this with?
As a parent and a provider, I would say don't give up. If there's something in your gut, I feel like moms know more instinctively than dads do. Sorry, dads. But there's just this gut feeling that we have. We carried our kids, and it's just instinctual that we know that there's something going on. And I just would never give up. There's always something. And don't let anyone tell you that it's normal.
Yes, I love that. It's one of my mantras to say, there's always an option. There's always an option. And what I hear you saying is like, oh, you just don't let it. You're like, I'm going to go find it. So you're a girl after my own heart and soul. We enjoy some of the very same things. So thank you so much for coming on today.
Thank you for having me.
They just keep breaking. I gotta get myself a little more faith,